Hello, I'm Dr. Meredith Jones from Kansas State University. I'm an assistant professor here in agricultural practices, and one of my interest areas is in alpaca and llama medicine. And so today I'm going to discuss with you basic camelid behavior, handling, and monitoring of their health. And what this talk is really designed for is for veterinarians without previous experience with llamas and alpacas, or veterinary students, veterinary technicians, farm sitters, other farm labor, or new owners who are just seeking more information on how to work with their animals. So the outline for this talk is that we're going to talk about some basic information about camelids, talk about camelid behavior, how these animals like to move with the herd, how they should be approached, and how we can appropriately handle them in a way that works with their behavioral instincts. We're going to talk about some feeding behavior and principles. We're not going to spend a lot of time on the nutritional aspect of this, but we're going to talk about just the basic principles of feeding herbivore species and specifically camelids. We're going to talk about, then the last section will be common problems, and so we'll talk about common symptoms that we receive phone calls about or common concerns that come up in camelid herds. Whether or not you need to call the veterinarian when those occur, is it an emergency, how big of a concern is it, and what can you do? Then finally we'll talk about administering medications, and so if you have animals that need to receive injections or anything like that, how you can get that done effectively and safely. So the South American camelids, which is what we're talking about here today, include the llama, alpaca, guanaco, and vicuña. And the llama and alpaca are the two domesticated species that we see here in North America. The guanaco and the vicuña are still wild type animals. And so again, here in North America, you're going to see the llama and alpaca most commonly on farms. Occasionally, you will see guanacos and vicuñas in some rare farm situations or in zoo situations. And so this is a typical llama. They're a long, lanky animal with, of course, that have the long neck, typical of all the camelids. Remember that these are relatives of camels, and so they are similar to the Bactrian, the two-humped camel, and the dromedary, the one-humped camel, and so they sort of have that kind of general body shape and long neck. The llama is quite a bit larger than the alpaca. They can range anywhere from about 200 to 375 or 400 pounds, and they have banana-shaped ears, and you can see that well in this animal here. Then we have the alpaca, a much smaller, more compact animal. You see the animal here on the left has kind of that fluffy, dense type fiber. That is the wakaya. And then on the right is the suri, a different type of alpaca, and they have the fiber that tends to hang in dreadlocks, but both of those are alpacas. Again, smaller body type, typically about 125 to maybe 175 pounds in the adult animal, and they have a more pointed ear rather than that banana ear that we saw in the llama. And so, camelid behavior, they have a tremendously strong herd instinct, particularly the alpacas. They do not like to be handled by themselves. They want to stick with the pack. So we like to always work with them in groups of at least two, and if we have to move one from one area of the farm to another, or we have to take them to a veterinary clinic or to a veterinary hospital, we want to make sure that we take a healthy, calm buddy along with them so that they've got a pal with them. If we have to move a mom or a cria, we want to make sure that we take those along. And so, for instance, if we have a sick cria and we're going to take it somewhere to be treated, we want to make sure that we take mom along. Similarly, if we've got to take mom somewhere, we need to take the cria along. That helps with the stress for both of them. Moms don't like to be separated from the babies, and the babies don't like to be separated from the moms. These species also tend to really resent having their heads handled. Some animals are very calm about their heads, but those are few and far between in my experience. Most of them really would rather not have their head and particularly their ears to be touched. And so when we handle them, we want to minimize the amount that our hands are on their heads. Certainly for the administration of some oral medications, for the placement of the halter, those kinds of things, we're going to have to touch their head to do those sorts of things. We want to move efficiently, quickly, and get that done and allow that animal to be released back into the group. These species, of course, can kick. With the hind limbs, they'll kick just like a horse or a cow does, kind of backing off to the side. The good news is because these animals are smaller, remember that the alpacas are kind of 125 to 175 pounds, and the llamas being 300 to 400 pounds usually. While they certainly can kick you, it's unlikely that you're going to be significantly injured by that. But it can sting, certainly those llamas, because they're so large. And so you want to be careful when moving around their back end. If they are surprised, some animals will kick. And then certainly what the behavioral characteristic that they're most famous for is the fact that they can spit. Llamas and alpacas both do this. Not all of them do it. I've certainly worked with plenty of animals that have absolutely never shown me any signs that they are wanting to spit. And then there are some animals that will just spit almost at the drop of a hair. So certainly we want to be prepared for that. And so I have an image here of an animal on the left-hand side who isn't particularly enjoying me approaching her with the camera. And so she is giving the classic "I'm about to spit on you" sign, which is that she's got her head kind of drawn back and sort of hunkered down. Her nostrils are flaring, she's a little riled up, and then you see that her ears are pinned back. And if you have any experience with horses, from previous experience with horses, you'll know that that ear pinning back is classic "I'm not happy" behavior. And so that's what she's saying to me. When you hear then, when they do this, and then you sort of hear this gurgling sound, or you notice some wave-like motion in their neck, the spit is coming. When a llama or alpaca spits, it is actually not saliva, like when we spit. It is actually their stomach fluid, or their first compartment fluid. And so it's going to have hay and other things in it, and it doesn't usually smell particularly nice. So you do want to avoid being spit on at all, if at all possible, but it doesn't hurt you if it gets on you. So be aware that this is an animal who's telling me, "I am stressed, I don't want you to be here close to me. If I have to capture this animal to work on her, I want to do it gently, calmly, because she is already stressed before I've even put my hands on her." And so, in addition to wanting to avoid the spitting, we want to make sure that we're prepared to handle her efficiently and be able to release her back to her pals. On the right-hand side, this same animal is exhibiting what we call cush behavior. And so this is sternal recumbency, so they are dropped down on their sternum or their breastbone, and they've got their legs tucked up under them. And you can see that we've got a halter and a lead rope out ahead of her. We were trying to walk her, and she decided to cush down. This is classic llama or alpaca that is resenting being handled, doesn't want to lead, and lays down in the cushed position and doesn't want to walk. When this happens, there is no point in pulling and yanking on the lead rope or the halter to try to get them to walk. They will not do it. And in fact, it will make them sort of cush even harder, if that's even possible. So that is useless. The best thing you can do is let off of the halter and lead rope, give them a little bit of slack back on their head. You can sometimes lift them up a little bit on the back end up under their pelvis, or a little bit lift them by their tail, and encourage them to stand up. Move quietly, gently around them. And many animals will eventually realize that since you're not yanking on their head anymore, that they will get up and walk. If they absolutely refuse to get up, the best thing to do is if possible, come back and work on them later. At this point, this is an animal that's kind of quit on you, and just let them relax, let them get settled back in, and then see if you can come work with them later. You'll notice this group of animals, this is our teaching herd here at K-State, and you'll notice that I'm walking up to this group, and the first thing they all do is everybody heads in the same direction. Of course, they're trying to move away from me. That's typical behavior. Most animals, unless they're ultra friendly, are not going to come towards you. They're going to be able to herd away from you. And so everybody's headed in the same direction. You notice that they have moved together in a nice pack, and now they're wanting to move together. Even if I need only one animal out of this group, if I'm going out to give a vaccination or medication, or I just need to look at something, even if I need only one animal out of this group, it is best to move them all as a herd, and then once I have them contained into a smaller area, then I will be able to get my single animal that I need to work on. So if you're by yourself, and sometimes even if you're not by yourself, this can be a lower stress way to handle animals. And that is that you'll notice at this shed in the upper left-hand corner that we have a rope tied to the corner of this shed, and then a single individual has the rope stretched out and extended and is moving the entire group of animals up into that shed. Animals will respect that rope. Other methods that you'll see with this will be long pieces of plastic conduit that an individual can use, basically almost like a trapeze bar, to walk towards the animals and move them as a group, and you can place them in a corner of a lot that way. And then you'll notice in the lower right-hand corner that everybody's in the shed now, and we're able to tie that rope across and have them contained. This is extremely low stress. We don't have a lot of people standing around. Nobody's hooting and hollering or doing anything. We were able to move the entire group in with just one person. So then, once we have them in a smaller area and we need one animal out, we can try a couple of things. One is that very calm animals that are used to being handled, you can often just walk up to them and place your hand on the middle of their back and be able to place a halter on them without any trouble. Some animals are going to be a little bit more skittish and not quite used to that. And in those animals, the easiest thing to do, as you see in the upper left-hand corner here, is that we've dropped a lead rope down around their neck and allowed it to fall to the ground. And most animals, once they feel either the touch of a person's hand or that lead rope on them, will sort of freeze. And they'll just stand there, and that will allow us then to grab the lower end of that rope, loop it back up, and now we have them caught in a very low-stress, gentle way. Now we can move our way up the rope, put our arm around their neck, and be able to slide the halter over their nose. In haltering, while this seems like a very innocuous and very safe procedure, in llamas and alpacas it can be dangerous. And the reason is that the distal or the lower 1/3 of the bridge of their nose is made out of very, very soft cartilage. It is not hard bone, as in horses or cattle that you may be more familiar with, or sheep or goats. And so you see in the upper left-hand picture that the halter is able to, if you're pulling down on it as you're sliding it over the nose, can collapse the nasal passages and make it unable for where that animal cannot breathe. Llamas and alpacas are what we call semi-obligate nasal breathers, which means they are not able to breathe effectively through their mouth. And so if their nose is occluded for any reason, they are going to have extreme difficulty in breathing. They cannot simply open their mouth and breathe as we can. And so that can make haltering extremely stressful and dangerous if the halter is ill-fitting. And so you see in the upper right-hand corner, we have a very poorly fitting halter. It's way too small for this animal. It's collapsed the nasal passages down. In the lower central picture, you'll notice that we have a halter that is still slightly too small. It's already started to kind of bend the bridge of the nose down, and I hope that you can appreciate that on there. And this animal needs a larger halter size. And so if you're out catching an animal, you put the halter on and see that it's going to ride down on the lower third of the nose, you need to go and find a larger halter. And so this is an image of a properly fitting halter. This girl on the upper left has a halter that fits her perfectly. The bridge of the nose portion of the halter is riding up high, close to the eyes, and that is up on the bony portion of her nose, and there is no way now that halter can collapse down her nasal passage. If you can't find a halter that fits for an individual animal when you're trying to work with them, a rope halter from cattle, sheep, or goats will work just fine. It can be adjusted and allowed to have that piece of rope that goes over the bridge of the nose to ride up high. Then, as an additional kind of bonus portion to haltering is when you have those animals that simply we cannot control their spitting. And again, those animals in my experience are few and far between, but every once in a while you'll get one that just won't tolerate being handled very much on a particular day. And so, to keep ourselves from being covered with spit and stomach fluid, we can place a little spit rag over the halter. And what this is just a lightweight towel or piece of fabric. It needs to have enough density to it or enough thickness to it and weight that it can't be sucked up into the nasal passages. And so sort of a lightweight piece of fine cotton fabric or knit fabric really wouldn't be appropriate for this. And so this is actually on this animal is just a surgical towel that we use around the hospital. And if she was a spitter, she actually isn't. She's just a good demonstration animal. We've tucked this huck towel into her halter, and it's hanging down in front of her face, and that will at least then contain the spit. When you're using spit rags, two big things you need to keep in mind. Number one is it can be stressful to some animals to have their nose and mouth covered this way. Most animals, in my experience, it doesn't bother them too much. But if you place it on an animal and it causes them to panic, we need to not use that. Secondly, we need to make sure, again, that they're able to breathe through it. And so particularly on a very hot day, that animal may be breathing hard and may be sucking that towel back up, and that may be limiting the amount of airflow that they can get through their nose. And so in that situation, it is not appropriate to use a spit rag on that animal. Then we can use an ear twitch. This is in the animal that is not tolerating what's being done. It can be used as a relaxation technique because it results in the release of some relaxing hormones. But what you do with this is and again, this just provides some additional restraint and gives an animal a settling effect when they're on a halter. And so you can see here in the upper left-hand side that the operator has placed her hands around the base of the animal's ear and is merely squeezing. She's not pulling, she's not twisting, she's not doing anything like that, just squeezing down right where the ear meets the head. And then you can see in the upper right-hand picture that she's just got the animal's head nestled in the crook of her arm there so she can control the head completely. Down in the lower picture is absolutely what not to do, and that is to grab out at the end of the ear and bend. We can fracture the ear cartilage and do some damage and cause bleeding in the ear, or again, fracture of the cartilage, and so we don't want to bend the ear. We only grab it down around the base. So a dental pad massage is another kind of relaxing technique. If we have an animal that is a little bit stressed but we need to handle them, we can perform a dental pad massage. Llamas and alpacas, similarly to cattle, sheep and goats, do not have upper incisors, and so they have just a dental pad there. It's kind of a firm pad that's covered in basically gum tissue, and you can place your finger in the split of their upper lip and be able to massage that dental pad then and provide some relaxation. And so you see here that the operator is taking his finger and just rubbing this dental pad where there are no upper teeth in the split between those lips, and providing some relaxation to that animal. In addition to that, we can do what is called a tail massage. And so you'll see in here the operator is going to walk up to the animal calmly, touch her gently, and then rotate her tail around the base. Another nice calming thing that you can do if an animal is a little kicky at the back end, is not wanting to have their back end handled, this can be a nice way to relax them. Additional restraint can be provided by llama and alpaca chutes. The one on the upper left-hand side is a larger llama chute. The one on the lower right-hand side is a smaller alpaca chute, and these are commercially available. And so what we do with these is, again, on the upper left-hand side, you can see we've got a female alpaca in the chute, and you'll notice that it has sides on the door, or doors on the sides of the chute. It's got a padded head gate, so we can place their neck in there and be able to compress those. But the padding protects the animal from the metal. You notice we still have a halter on her, and then we have that halter attached to the chute by the methods of by chains. Also can be done with ropes as well. What's important about when you tie the head up, as in that picture, is that you'll notice over on the upper right-hand side that we have a quick release snap, and we always recommend the use of those quick release snaps whenever you have an animal tied up, so that if that animal were to decide to drop down into the cushed position or may throw a fit in the chute, we don't want them to be able to torque on their head or neck. And so we want to be able to reach up, release that quick snap, and allow them to go down if that's what they're doing. You can also see in the lower right-hand side, we have another alpaca in the alpaca chute. We have the side doors opened up, and then we have what we call these belly straps in there. And this is if you have that animal that's wanting to lay down, but we need to do something up underneath their belly. So for instance, if we're trying to clip the fiber out from underneath there, or we're trying to examine the udder, or the veterinarian is trying to do an ultrasound exam, we will place these padded straps up under them and sort of allow the animal to suspend there. Their feet are still on the ground, so they still feel very comfortable, but they are not able to lay down at this point. And again, those are attached with quick release snaps so that if the animal looks like she's going to really resent that and may injure herself, we're going to be able to release those very rapidly without having to untie a knot. So, feeding behavior and principles. Most feeding programs on most farms do include and should include hay or pasture access at all times, which should make up about 75% of the total amount of feed that's available to them. And then depending on an animal's production stage, so whether they're a growing animal or a lactating animal, or they're breeding, or if it's just a gelding that's kind of standing around not doing very much for a living, we will determine their need for additional supplement in addition to the hay or pasture. And so that may include a pelleted or extruded feed or a grain, and those typically, except in specific instances of metabolic stress or something like that, should not comprise more than about 25% of their total feed intake. Remember that Camelid should never have access to cattle, horse, swine, or poultry feed. And the reason for this is that these species, the cattle, horse, swine, and poultry, have very high tolerances for copper, and their diets are very high in copper. Camelids cannot tolerate those high levels of copper, and copper toxicity can be fatal. And so if you have other species feeds on the same farm with camelids, we need to make sure that we don't accidentally feed those other feeds to the llamas and alpacas, and we also want to make sure that the llamas and alpacas can't accidentally break into where those feeds are. Then every herd needs to have access to a trace mineral supplement. Those can come in a loose formulation or in a block formulation. Our experience has been that camelids tend to consume the loose mineral much more effectively and efficiently than they do the block minerals. And so those typically are, in my opinion, much more effective. But those need to be available to animals at all times, year-round. So I'll just have some pictures here, and again, I know that the audience is at varying levels of experience, and so this may be very basic for some people, but it may be new information for others. And so as we go through this talk, I hope that everyone will sort of bear with making sure that we cover and cater to all the different levels of experience that may be watching this talk. And so in the upper left-hand corner, excuse me, I have a photograph of just grass hay, or what some people will call prairie hay. And so this can be made up of a variety of grasses, including brome and others. But it's typically a moderate to low protein feed, but it provides a lot of fiber, which is very good for the digestive health of llamas and alpacas. The upper right-hand picture is alfalfa hay. It can be differentiated from grass hay by the presence of little round green leaflets throughout the hay. Good alfalfa is much higher in protein than most grass hays, and so then can be fed to animals who are in need of higher protein levels in their diet. And again, it also provides lots of good fiber. The lower picture is straw, and it has a very yellow cast, and it tends to be very shiny. And it's important that we differentiate that is not a hay to be fed. Yellow, shiny straw is typically only used for bedding purposes, and so we want to make sure that we don't mistake grass hay and straw and accidentally put straw out as an animal source of feed. It has little to no nutritional value, does provide a little bit of fiber, but we would never want to use straw as a feed material. So the supplemental feed types up on the upper left-hand corner, and I have all these labeled for you, are beet pulp shreds. I don't really have a good analogy for what they look like. They look like shredded feed, essentially. And those are a good source of fiber, and they provide energy as well. And so that's a common feed stuff that is used as a supplemental feed in llamas and alpacas. Extruded feed is in the upper right-hand corner, and it has kind of this dog food appearance almost. And what's interesting about it is that it contains lots of great nutrition, but the pellets break down when they are consumed by the animal. And so this feed is highly desirable in llamas and alpacas who do have, some animals have some problems with choking. And so this type of feed is designed to prevent choking by allowing those pieces of extruded feed to melt, basically melt in the mouth, versus going down into the esophagus and potentially packing in. On the lower left-hand side is a classic pelleted feed that's available for most species, and there are llama and alpaca designed pelleted feeds. Those don't fall apart typically initially in the mouth as the extruded feeds do. And then there's a grain mixture on the lower left-hand side, and again, it's very important particularly with the grain feeds and the pelleted feeds, to make sure that you're looking at the bag, make sure that it's for llamas and alpacas before you feed it, and make sure that it's not labeled for horses or cattle or other species. Continuing on with this topic, feeding should be consistent in the amount and time each day. And so if we feed them typically in the morning and the evening, we want to make sure that we stay on that schedule. And the reason for that is that animals' digestive tracts adapt to that over time, and we don't want to significantly change that. Any kind of sudden change in a feeding program can result in significant digestive upset. And typically when we do make changes in any kind of either what we're feeding or when we're feeding or how much we're feeding, we typically make those changes gradually over 2 weeks' time. And so we certainly don't from one day to the next want to do any kind of major changes to any animal's ration. We also want to monitor for equal feeding time. And you'll see this as you start to watch these animals. Any animals in a herd will do this. You will have kind of the big, powerful alpha animal, and then you'll have the meek and mild little guy. And so we want to make sure that if they're all eating along a trough, that the big guy isn't beating up the little guy and that the little guy still gets enough feed. This is a very common cause that we see of significant weight loss and failure to grow in young animals, is being beaten off by older, more mature animals. We want to make sure that we either spread individual feed pans out so that they're not fighting amongst themselves, or that we have a long enough trough space that everybody can get up to the trough and get plenty to eat. We want to always make sure that there's plenty of hay or pasture available. We feed hay and pasture at what we call an ad lib rate, so it's always available. All they want is always out for them. And so if we put a bunch of hay out at 8 o'clock in the morning, when we come back at 3 o'clock in the afternoon, it shouldn't be empty. There should still be hay there. And there should still be hay there at 7 o'clock and 8 p.m. and throughout the night. When you come in the next morning, there should still be a small amount left. We certainly don't want to be wasteful, but there should be hay available around the clock. If animals are out on pasture, of course, then they've got that forage available to them there. We want to make sure they always have plenty of fresh, clean water that's palatable. So we don't want algae growing in it. We want to make sure that it is at a temperature and a cleanliness level that the animals will want to drink it. Some farms, particularly during the hot summers, will place electrolyte-containing waters out for animals. And what those are basically water or powdered supplements that contain different minerals, some sugars, and other things like that, and you mix them in with water, and they often change the color of the water. What's important to know is, if you put out that electrolyte water, you must always have plain water available too. Electrolyte water should never be the only water source available to animals. A couple of reasons for that. Number one is that some animals just won't drink the electrolyte water. They just don't like the taste of it. And so we don't want those animals to not get to drink at all because they refuse to drink the electrolyte water. We want them to have another option. Secondly, if animals consume a lot of the electrolyte water, or we've mixed the electrolyte water accidentally a little stronger than it should be, we want the animals to be able to go over and drink the plain water to be able to re-equilibrate that. You actually can get to some dangerous levels of some minerals if animals consume too much electrolyte and not enough plain water. So we've got to always have both of those available. Now we'll move on to the section about common problems. When is it an emergency? When do I need to call the veterinarian? And what do I do in the meantime? Okay, so the first thing that we often get calls about is that we have an animal that's not eating. And unfortunately, that doesn't give us a lot of information. Not eating is the most common thing that any sick animal will do. And so it can indicate anything potentially to be wrong with that animal. But the most common things that we see are stomach upset, intestinal upset, infection, fever, and pain will also cause animals to not want to eat. Is it an emergency? It can be. It is an emergency if you don't notice that the animal is passing any feces for more than a few hours. If you notice when you view the animal from behind that their abdominal contour is changed. So for instance, if they're normally sort of slender when viewed from the back, is their belly now more rounded out? Are they depressed? you notice that they're feeling sick in addition to not eating, or are they wanting to lay down more, they're hard to get up and move around, are they having trouble breathing, or do they have a very high temperature when you take their temperature. Adult llamas and alpacas should have a temperature around 99 degrees. When do you call the veterinarian? We usually base that on the duration of time that they haven't been eating well. If they're eating less than normal, so less than the normal amount, but still some, we may choose to watch that animal for a day to see if there is improvement. The reason for that is that if they're still kind of picking along and eating a little bit, they may just have a simple indigestion or a little bit of a stomach upset, and they may snap out of that in a day. If they're not eating at all, the veterinarian should be called and informed of the condition so that they can determine the need for whether or not they need to come out immediately or whether we can wait for a little while. But again, if they're eating less than normal and that goes on for more than a day or two, then we need to call the veterinarian. What do you need to know when you call? When did you last see them to eat normally? Are they not eating at all, absolutely refusing all kinds of feed? Or are they eating less than normal? Are they preferring to eat hay only and not wanting to eat their supplement, or vice versa, eating the supplement and not wanting to eat the hay? That can give us some clues about what's going on. Have they been completely normal up until now? Up until yesterday, they look fine. Now today, they're not wanting to eat. And then have you seen any associated weight loss? When you put your hands on the animal, do you notice that they've had weight loss? What do you need to do until the veterinarian comes? Do as they recommend when you call them over the phone. They may ask you additional questions over the phone that may help guide what needs to be done. You want to offer them, make sure they've got fresh water and a highly palatable feed. So if you've got other types of supplements around, or maybe alfalfa hay around, you might place that in front of them. Many animals really like alfalfa hay, and so while they may not be willing to eat grass hay, they may be willing to eat a little bit of alfalfa, and we want that to be in there for the fiber and the protein. We may move them to a sheltered area, particularly if it's very cold or very hot outside. We want to be able to protect them from the elements. And then again, as we talked about with the herd instinct at the beginning, take a pal along. Give them a nice healthy buddy with them so that they're not isolated and alone from the herd, because that alone can exacerbate whatever problem they have going on with the stress of being isolated. So weight loss, what does it mean? Can go along with not eating, like we just talked about. We commonly see it associated with intestinal parasites in particular, but we can certainly see it with the external parasites like lice and mange mites. Chronic infectious disease, infections somewhere in some organ or an abscess internally or externally may be sort of stealing their nutrition as they're trying to fight that off. We'll also see it with liver disease or gastrointestinal disease. Is it an emergency? Typically, no. Most weight loss occurs slowly and over time. Occasionally, we will have situations where an animal is presented to us that it appears that the weight loss has occurred suddenly. And in those situations, we certainly do need to call the veterinarian. But typically, weight loss has been occurring over time. And so while we don't want to delay treatment, it's not necessarily an emergency right now. When you call the veterinarian, we'd like to know how much weight you think they've lost. And so if you keep records, monthly records of weighing animals, that can be very useful to say they've lost 20 pounds over the last month, something like that. We'd like to know if you've seen an appetite change and for how long. Have you thought that they seemed a little off maybe for the last week or so, but weren't quite sure what was going on? And then are there any other animals in the herd affected? And so when you see one animal in the herd who has lost some weight, it's a really good idea to go move through the rest of the animals and put your hands on them and see if you think that they seem thin to you as well. What do you need to do until the veterinarian evaluates? Again, offer them highly palatable feed. We may give them a little alfalfa hay and see if they want to eat that. It may be useful to feed them separately from the herd, particularly if you know that this animal is kind of the low man on the totem pole. It may be useful to move that animal and another low man on the totem pole buddy off to a pen by themselves so that they don't have to compete for feed anymore. And it's important that the buddy, again, is a calm animal that won't beat up the guy that's losing the weight. And so you've got to select your buddies here appropriately. And then make sure, while you're waiting for the veterinarian to take a look at them, now that you've got them separated off, you should be able to get a much better idea of what their eating habits are like and how well they're eating. Oftentimes in these large communal feeding settings, it's impossible to know how much one animal is consuming. But once you pull them off to the side, now we'll be able to determine how they're eating and how much. Another common call we get is colic, and remember that colic is not a diagnosis. Colic isn't a disease. It is a clinical sign. It is, all the word colic means is I have abdominal pain. Again, it doesn't really give us necessarily a lot of information, but it certainly does get us pretty excited because these animals are very, very good about hiding disease. They know not to act sick until the very, very last minute, until they can't help it anymore. And so a llama or alpaca that is acting like its belly hurts is typically an emergency, and we need to make sure that we're making a phone call to the veterinarian. What it can mean is a stomach ulcer, hairball, some other kind of stomach or intestinal upset, distension, all the way up to a twisted intestine. And in mid to late pregnant females, we often get excited about colic and worried about it because of the risk of uterine torsion. So where they have a twist in the uterus that can cause significant compromise to the mom, to the uterus, and to the baby. Is it an emergency? Yes. And as I've already alluded to, these animals are extremely tolerant of pain, and they know to hide their pain. And so when they're showing overt signs of pain by either kicking at their belly, laying down and rolling excessively, those kinds of things, we're going to want to make sure that we get those animals examined in very rapid fashion. It's important to know, if you haven't been around llamas and alpacas very much, is they will often roll around and take these little dust baths. And that's actually what this animal is doing down here in the lower picture. This is not a colicking animal. He's just rolling around in the dirt, playing around. And that's very common behavior. And so if you see an animal that's acting that way, monitor them and see if it's just a playing behavior. Is that animal bright and alert and walking around otherwise, or is that animal uncomfortable? Much more commonly in llamas and alpacas than kicking at their belly or rolling around, that kind of behavior, is simply standing off by themselves or laying off by themselves and being very, very quiet. And so that can be, these animals often don't respond violently to pain. They much more commonly respond by being very quiet, very sullen, and separating themselves from the herd. So we really need to be very in tune to what is normal behavior for these animals and to notice when that has changed. What to know when you call. How are they acting? Have they been eating normally? Have you changed their feed? Did we decide last week that we were going to add in a different feed into what they were eating? Have you noticed urination or defecation? Have you noticed a change in the way their belly looks? And if it's a pregnant female, when is she due? What to do until the vet evaluates? Don't get them riled up. They're already uncomfortable. They're already in some pain. We don't want to do a lot of handling or get them worked up. We're going to walk them around slowly, and if we're going to load them up to take them into the veterinarian, we're going to make sure that we load them onto the trailer very quietly and gently. In the meantime, be watching for them to pass any urine or manure, so that when the veterinarian arrives or you arrive at the veterinarian's office, you can say, I hadn't noticed any fecal passage before when I called you, but then I did notice that she passed some in the trailer. And so we'll want to know that. Straining is another one that we often see. It can be caused by not being able to urinate, which is most commonly caused by a stone in the bladder that drops down into the urethra, most commonly seen in males. We may see it because they can't pass any stool because they're constipated. There can be an intestinal obstruction. It may be a pregnant female that's due to have her cria and may be having some difficulty. And then certainly we have a couple of parasites that specifically cause straining, and those are most commonly coccidia and whipworms. One of the behavioral aspects of llamas and alpacas that I didn't mention earlier, I was saving until this point, is dung piles. And so when you walk out into a pasture or a dry lot where llamas and alpacas live, you will notice these community latrines. And there may be one of them in a pen, there may be 4 or 5 of them in a pen. And so these are small circular areas where the animals have chosen for themselves, for the herd, that they are all going to defecate and urinate at that site. And so you will notice animals throughout the day going over to that area and posturing to defecate or urinate over that community latrine. We typically have owners clean those up with a wheelbarrow or haul those off either daily or weekly, depending on how much land they've got and how many animals they have. And so what you want to do is keep an eye on the animals that are going to those dung piles and visiting them. Are they staying there longer than other animals are, or are they repeatedly going back very frequently? And so again, that's a pattern of behavior that you're going to need to watch over time. And you may notice that there's an animal that keeps going back to the dung pile several times, much more often than anybody else is. Or you may notice an animal that goes and stands over the dung pile and just hangs out there for a while and isn't producing anything. So if they're hovering over the dung pile and you don't see urine coming out and you don't see fecal matter coming out, we need to be concerned about that animal. Is it an emergency? All of those causes of straining that I talked about are an emergency, with the exception of the coccidian whipworms, the parasites. Those do need to be dealt with urgently, but they're not emergencies. If there's abdominal distension, if you can tell that there's a difference in the contour of the abdomen, if they are not producing feces and urine, so they're hovering over that dung pile and they're not producing anything, or if it's a late-term gestation female and is due to give birth, then it's an emergency. When do you call the veterinarian? If straining accompanies other abnormal behavior, so they're not eating very well, if you do notice this kicking or rolling, or again, that animal that's standing off in the corner by themselves very quietly, that animal may be every bit as painful as the animal who's rolling or kicking at their belly. If urination or defecation are not observed within an hour of a straining episode, then we need to be concerned that there may be some kind of blockage or obstruction. What do you need to know when you call the veterinarian? Stage of gestation, if it's a known pregnant female, if there's a change in the shape of the abdomen, when did you last see them urinate or defecate normally? When was the last time they ate normally? So if they ate fine yesterday morning, we didn't think she acted like she ate very well last night, and now this morning we think that she's uncomfortable in her belly. The last time we saw her eat normally really was yesterday morning, and so we want to make sure that we report that. What to do until the veterinarian evaluates? Depending on your level of experience and expertise, the veterinarian may have you do a digital exam with a gloved finger to see if there's any constipation in the rectum, may have you do a vaginal exam to see if the cria is coming in a pregnant female. They may talk you through giving an enema, something like that. And so it just depends on the questioning and the discussion with the veterinarian and your level of comfort and expertise about what we can do while we're waiting on the veterinarian to arrive. A very common and very stressful situation that we can get into with llamas and alpacas are when they don't want to stand or are refusing to stand. And this can mean a variety of things. There may be something wrong with the brain or spinal cord. There may be something wrong with the muscles. We will sometimes see significant muscle damage in animals that get very, very stressed. And then we may see metabolic disease. And so a variety of conditions can occur in llamas and alpacas resulting from different electrolyte abnormalities or different liver disease that can certainly cause animals to become so weak that they're unable to stand. One of the unfortunately most common causes that we see with animals that are down and recumbent is heat stress. And heat stress can be either a cause of an animal to go down and not be able to stand, or it can be the result of an animal not standing up. And the reason for that is that llamas and alpacas get rid of a lot of their heat off of their ventral abdomen, so their lower belly. And if they are down and sitting in the cushed position and can't stand up, they are unable to get rid of heat from their belly. And so if it is warm outside and they are down because of some metabolic disease or because of some spinal cord disease, you may get heat stress on top of that primary disease as a result of them laying there for too long. And so we've got to be very, very aggressive in getting recumbent animals examined and diagnosed and appropriately treated. Heat stress, as I said, can be a primary disease as well. We get very, very concerned about it in the summer and on into the fall quite a ways. And depending on what kind of spring we have, it can also be problematic. It is going to change how we handle animals. The heat stress index is an important number that we look at that shows us that humidity and temperature are equal contributors to heat stress in llamas and alpacas. And so if we take the humidity in percentage and we take the temperature in Fahrenheit and we add those together, if they come up to be less than 120, we can generally say that it's safe to handle llamas and alpacas. So we can gather them up to shear them, we can gather them up to vaccinate them, We can move them around if we need to change pastures, those kinds of things. That is generally considered to be safe to do if it's less than 120. If the heat stress index, so humidity plus the temperature, is between 120 and 150, we shouldn't handle animals unless it's absolutely necessary. This is not the time for us to be trailering them to another pasture or hauling them over to the breeder, those kinds of things. We need to avoid it there. If the heat stress index is greater than 160, we should only handle the animals or move them if it is an absolute emergency. The reason that these are important to keep in mind is when the heat stress index is above about that 120, 150, we want to go out in the morning, feed, water, clean, do whatever chores we need to do, and then leave the animals alone. We don't want to be handling them unless we absolutely have to. So we're going to observe these animals from a distance. We're going to be very in tune with their behavior, but we are not going to be out moving them around, sorting through them, doing those kinds of things. If in the summertime we need to do those kinds of things with animals, if we need to gather them up for some reason, we want to do that very, very early in the morning when the heat stress index is very low. We don't want to wait until 2 o'clock in the afternoon to get those kinds of chores done. So, is it an emergency? Yes. If these animals can't stand up, there is a really good reason for it, and it's usually pretty severe. And so we have got to get those animals treated. The other reason is that our medications become less and less effective the longer they are down, and the likelihood of getting them up and getting them recovered drops significantly the longer they've been down. We want to be able to report to the veterinarian how long they've been down, and did you notice anything unusual about this animal before you noticed them down? Did you notice that yesterday they seemed a little wobbly on their back legs? Did you notice that a couple days ago her appetite started to drop down? Those kinds of things we're going to want to know. What do you do until the veterinarian evaluates? Keep them cool if it's in the wintertime. Keep them cool if it's in the summertime. Keep them warm if it's in the wintertime. And so if it's in the wintertime and they're out laying in the snow and can't stand up, we're going to want to bring them into a shed where they're out of the wind, bed them on some straw so that they can be a little bit warmer. Don't let them lay out in the cold. Similarly, in the summertime, if they're not sheared, we're going to want to go ahead and get them sheared so that they can get rid of some more heat. We're going to want to encourage them to stand up if at all possible, to try to let them dissipate a little heat off of their belly. If they're laying on their side, we want to roll them up on their chest. As we said, that can be problematic from a heat dissipation standpoint, but the more immediate threat is the fact that these animals with their large first compartment stomach can produce a lot of gas, and they can bloat, and that can interfere with their ability to breathe. And so we don't like for these animals to stay on their side for any length of time. If you roll them up on their chest and they won't stay there, you need to take bales of hay, block in around them to sort of hold them and prop them in that position. They've got to stay up on their chest all the time. Want to make sure that we place food and water within their reach. Make sure we don't handle the head and neck harshly. Don't pull. And the reason for that is if they have a neck injury that we don't have diagnosed yet, we can make that worse. After the veterinarian evaluates, it's very important to be very aggressive, that if the animal is being treated for what the veterinarian suspects is going on and they're not showing significant improvement in about 24 hours, then it's time to really pursue doing additional diagnostics. We may want to do some blood work. We may need to do some x-rays, those kinds of things. But again, as I said earlier, the longer they're down, the less likely it is that we can get them back up. And so we don't want to delay and take the kind of wait and see approach. We want to be very aggressive about getting them diagnosed if they're not responding to treatment. Choking is a very frightening thing that can happen to llamas and alpacas. It's frightening for the animals, and it's frightening for the person who's observing it. What it almost always means is that there is feed packed in the esophagus. There are other things, tumors, abscesses, other mechanical problems, functional problems that can go on with the esophagus that will cause animals to choke. But by far and away, the most common cause that we see is an animal that has feed packed in there. And you notice in this female alpaca down in this picture here, has her neck extended. You can tell that she's stressed. Although they're out of the picture, you can sort of tell by the contour of her head that her ears are pinned back, she's scared, and she's salivating excessively. Is it an emergency? Absolutely. Just like when a person is choking, when a llama or alpaca is choking, there is the risk that they are then also unable to breathe, in addition to it being extremely stressful. And so we've got to be able to get the choke relieved and get them comfortable. What to know when you call the veterinarian: how old are they? What type of feed are they on? And if you've ever noticed any other problems with this animal before. So has this animal been standing with its head and neck extended for the last few days, but you didn't really know what was going on? Anything like that can be really useful clues for the veterinarian. What should you do until the veterinarian evaluates? Move the animal very quietly to a safe area, again, with a buddy to help reduce stress. If it is in the summertime or the animal is hot, and they frequently will become hot during these choking episodes because they're so excited and they're kind of panicking as a result of this choke, make sure that we cool them down, get them in the shade, may cool them down with a little bit of water, those kinds of things to keep them more comfortable. Preventing choking, we want to identify who is most at risk. And the animal that runs up to the feed trough and inhales all the food, literally and figuratively, is the animal at most risk for choke. So if you don't stop and chew your food, you're going to be more likely to choke, and the same is true for them. Certain feeds can be bad about causing choke as well. Beet pulp can be, small grains can be, and pelleted feeds can all pack in the esophagus very easily. And so in animals that we know are bad about choking, or that we're feeding feeds that we suspect may be bad about causing choke, we'll usually mix in a little bit of water and soak those feeds to make them easier to swallow for those animals. The next thing we're going to talk about is normal birthing events and how to handle birthing difficulties. And this is a pretty stressful, even for experienced people, this can be a very stressful time. The expectation of a new cria and hoping that everything goes well. And so we're going to start off by talking about normal birthing events. What we call stage 1 labor. It starts with the initial uterine contractions and ends with the water breaking. And so you may notice an animal that is kind of standing off to the side by herself, starting to kind of isolate herself from the herd. If you know she's in late gestation, we need to be watching her very closely, because she may be in those early contraction phases that you can't see from the outside, but she's starting to feel them, and then you may notice when her water breaks. That period of kind of those early contractions, standing off by herself, can last anywhere from 2 to 6 hours. Stage 2 labor is when they're actually in full-fledged labor and are about to deliver the cria. At this time, they are in full-blown abdominal press. You may notice them laying down on their side and straining, and they should have the cria out in about 10 to 30 minutes, depending on the mom's experience level and how well things are going. So, once we see her trying like that, we need to be making significant progress in having a cria out in 20 to 30 minutes, or we need to be providing some assistance. Finally, once the cria is out, stage 3 labor is when they pass the placenta. And that can be anything from the placenta coming out right behind the cria to up to 6 hours. But we never want the placenta to stay in longer than 6 hours. The time to intervene is when no progress is made 30 minutes after the onset of stage 2 labor, or you notice this standing off quietly, water breaks, those kinds of things, and they never do go into the pushing phase. That is going to require some intervention. So, why do animals have difficult births? 3 main things. 2 of them are much more common in llamas and alpacas than in other species, and those 2 are fetal malposition, so the cria may have a head turned back or a leg turned back or maybe coming backwards, so they're not positioned correctly in the dam. And then uterine torsion. Again, this twisting of the uterus that can cause colic, and they will not be able to deliver the cria when they have a uterine torsion. One of the less common causes that we see in llamas and alpacas is fetal oversize, maternal undersize. So basically, too small a mom, too big a baby. Is it an emergency? Absolutely. If they've been pushing for 20 minutes and they're not making significant progress towards delivery, we have got to get some intervention immediately. So following, I have just a few pictures of some of the things that you will see. And so you'll notice in this animal, we've got one front foot sticking out of the mom and a nose starting to come out and one foot's back. In this animal, we're going to need to move that left leg forward because you'll notice that it's in what we call elbow lock, so the elbow is pulled back, and that can significantly delay the cria being born and may result in it not being able to be born without any sort of intervention. This is a more normal delivery. We're seeing two front feet sticking out and a nose. It is normal for crias to come out nose and front feet first. They should come out forward. And so sometimes if this animal is not being delivered, it's usually just as a result of the cria being a little bit too big. And so these usually require a little bit of intervention to kind of help things along, but this is the normal presentation for a cria. Here is one of the ones that can be difficult to correct. We have the left leg of the cria is retained and held back, and this cria will not be delivered without intervention. The dam simply cannot push that cria out unless that left front leg is pulled forward, and so this animal is going to need some intervention. So if you see a nose and only one foot, you don't see the second foot, that animal needs to be examined. We have the leg crossed over here, and so you can see that we don't have the 2 feet coming out side by side like we should. A head turned back, we've got 2 feet sticking out, but we don't have a head. And so this animal is going to need intervention to bring that head up so that we can safely deliver the cria. Upside down, this doesn't happen very often, but it can happen. And so you'll be able to see this from the outside, that the feet are above the head and that the feet are upside down. A backwards cria has 2 feet coming out, and again, like the cria that was coming out forwards but upside down, the back feet, when they are right side up, they will look upside down. And so it can be very confusing, but back feet coming out first will often be pad up, so the bottom of the foot will be up. And so it's important that someone who is experienced goes in here and determines, are these front feet that are upside down or are they back feet? It's a significant determination that needs to be made as to whether or not we need to go in and deliver, bring the head up if they're front feet, or do we need to just deliver the baby in a backwards position. This is approaching a breech. This animal has its hocks up, but it's coming backwards, and this cria absolutely cannot be born without significant intervention. It is important to know that unless you are very comfortable and very experienced, we don't recommend the use of any sort of strings or chains or straps to use to aid in the delivery of crias as we do in other large animal neonates. Much more commonly, we simply prefer to use our hands to help deliver cria so that we don't do any damage to the leg. And as you can see in the picture on the right-hand side, it can be very easy to break one of those legs as a result of improper placement of straps or ropes. What do you need to know when you call the veterinarian? Is this a first-time mom, or is she experienced and has had crias in the past? Has she ever had problems delivering crias in the past? When is she due? Is this potentially a premature delivery, or is she overdue, or is she right on time? What parts of the cria are showing? Are the feet right side up? Do the feet look to be upside down? Is there a nose coming out? What's there? What's missing? How long have you been watching, and how long has she been trying? We want to keep the mom very still. If we are going to load her to take her into the veterinarian, we want to make sure that we get her up on the trailer very quietly. And then in paying homage to the Little House on the Prairie, we want to make sure that we have warm water and towels ready. Those are always useful in any delivery. We want to be as clean as possible, and we want to be able to get everything in the area dried up and cleaned up like we need it to be. And so having all those supplies available to us when we're going to intervene is always useful. So we've hopefully delivered a happy and healthy cria and have a nice, happy, healthy mom. Then the next thing that has to happen is she's got to pass the placenta, and it needs to be evaluated if she has not passed the placenta within 6 hours after the birth. And as I said, sometimes it'll come right on out with the cria, but many times it will stay in there for up to a couple of hours. We don't want it to be in there longer than 6 hours. If we note that, we need to call the veterinarian so that appropriate treatment can be started. We want to wrap the mom's tail and keep her back end clean so that they can be appropriately examined. And then while we're waiting, we want to be sure that we're getting the cria to eat. We don't want to just be focused on the placenta and not be thinking about the cria. In this meantime, we need to be getting him up and eating while we're waiting to deal with the placenta. Normal cria should stand and nurse within 2 to 4 hours, and a really good, strong, healthy cria is up and nursing within 30 minutes. They should nurse colostrum off of the mom, and we want to make sure that we look at the mom's udder and make sure that she actually has colostrum there. It's very common in llamas and alpacas for them to not make milk. Certain individuals, for a variety of reasons, may not produce milk well, and we don't want to just assume that she's got milk and not actually check. We want to make sure that that animal is nursing between 1 and 4 times an hour. We want that cria to be strong and aggressive and up there and nursing, and we want to make sure that mom is letting him nurse, not kicking him off and moving away from him. If that's the case, then we need to make sure that we restrain mom so that the baby has an opportunity to nurse. We want baby alpacas to be born at least 14 pounds, and we want llamas to be born at least 17 or 18 pounds. Anything less than that makes them high risk. They may be premature, they may not be premature, they may just be low birth weight. But we always like to weigh crias at birth and make sure that they meet those minimum standards so that we know that they have the best start at life. Again, we want to make sure the mom's got appropriate milk production, appropriate colostrum production, and then we also want to dip the cria's navel. And lots of people will tell you lots of different things. Some people will use a diluted iodine solution. Some people will use a diluted chlorhexidine solution or Nalbasan. And either of those is probably fine, but we need to make sure that we get that done as soon as the cria comes out. Our preference is if the umbilicus is actively bleeding after the cria comes out, which is highly unusual, but it does happen from time to time. If your veterinarian directs you to place a suture or a string around the umbilicus, we want to make sure that we do that down as low as we can, away from where the umbilicus enters the body, and then we don't want to leave that on there for very long, not more than an hour or 2. From time to time, we will encounter crias that are weak and don't nurse well, and it can mean a variety of things, including mineral problems. They may not be eating enough, sepsis, infection throughout the body, or they may have low blood sugar, and so we've got to aggressively treat those. Is it an emergency? Absolutely. There is not much reserve in most neonates to be not eating for a period of time. And you'll notice in this picture here, this was a case of a llama cria that didn't nurse very well for a while. And you notice that we have the intestine there, and then we have that clear sheet that basically connects the intestine to itself. That should be full of fat in any normal animal. And in this animal, you can read a newspaper through that. And that is a sign of an animal that absolutely used up all of its body fat as it was starving. And so we cannot allow these cria to go very long without eating. What do you need to know when you call? When was the last time you saw them nursing? How old is the cria? Was the cria born prematurely, or did it have any difficulties at birth? How old is the mom? And if you've examined the mom's udder, does it appear to not have any milk in it? Does it appear to have some milk in it? Is it warm or painful, or will the mom not let you touch it? What do you need to do until the veterinarian evaluates? Most of these crias are at risk of being very, very cold and having their body temperature less than 98 degrees. When that is the case, we need to get them inside, get them protected, get them bedded on straw, wrapped in blankets. We may choose to put a heat lamp over them. We've got to keep them warm until they go to the veterinarian. You may also notice animals that are lame. That can mean anything from just a minor sprain all the way up until a broken bone. It's an emergency if you see a break in the skin, obvious bleeding, they're not bearing any weight at all, they're just picking up the leg and won't put it down, if you notice any bones sticking out, or if there's swelling over a joint. If none of those are present and the animal will walk but not and clearly are lame, but will at least put the leg down and use it some, then we need to have the veterinarian evaluated as soon as possible, but it may not be an emergency. What do you need to know when you call? Front leg or back leg? Is it a mild pain, or will they not use the leg at all? Where is the swelling along the leg? Is it up high towards the body or down low towards the ground? Is there bone sticking out, or is there any bleeding present? What do you do until the veterinarian evaluates them? We want to avoid moving them, if at all possible, if there is an obvious fracture, if something is obviously broken. We'll want to splint them, and you can do this at home pretty easily by using either PVC pipe that's been split lengthwise or by using simply a stick. And what you'll notice is that on the lower right-hand side, I have an oval there that represents the bone, and then I have two pieces of splint, one up above and one off to the side. And when you splint a bone, it is appropriate to not only place one piece of splint on there. You want to always place two pieces of splint on there, and they need to be placed 90 degrees to each other. So they either need to be on the back side and the outside of the leg, or the front and middle side, or the front and off to the outside. We need some combination. Doesn't really matter where they are, except that the two pieces need to be at 90-degree angles to each other. And what that does is that protects the bone and the surrounding nerves and soft tissue and blood vessels from being further damaged. And it protects it in both directions, front and back and side to side. So we always want to place two pieces of splint 90 degrees to each other. And I have a picture down on the lower left-hand side that's kind of there to be funny, but it's a true story. We had a little dog brought in that the owners had taken coloring pencils and crayons and splinted a broken leg and some duct tape. And while that may seem funny, and it certainly is, it's highly effective. And so the purpose of me having that picture there is to remind you that you really can use about anything to splint a leg, and that you need to do whatever it takes to get a leg splinted before that animal moves and does any more damage to the surrounding tissues. We will occasionally see animals that are attacked by dogs that get cuts on them, break their legs, and other kinds of traumatic events. Is it an emergency? Yes. And the reason for that is that our drugs are much more effective if we can get them into the animal early before infection and other problems have set in. Only very fresh cuts can be sutured closed. Once they're old, we have to just let them scar over. And again, like we talked about with the fractures, we've got to get those stabilized immediately. So all trauma is considered an emergency. What do you need to know when you call? When did it occur and what happened, if you know? Oftentimes we don't know. And so it's important that if you have an animal that's been injured and you can't figure out why, walk around the farm and see if you can get any clues. Is there a nail sticking out from a side of a barn? Is there a piece of tin sticking off the side of the barn? Have you noticed stray dogs in the area that have been hanging around the animals? Those kinds of things we may need to have to give us clues about what could have happened. We want to know if there's any active bleeding and where that's coming from. Can the animal walk? And something that we don't necessarily need to know right at the minute that you call, but we will want to find out, is when was the date of their last tetanus vaccination. Because any animal that is wounded, we're going to want to make sure that we have covered prevention for tetanus. What to do until the veterinarian evaluates? We want to stabilize any fractures with splints. We want to keep things clean, make sure that we're not getting hay in any wounds or any dirt in any wounds, if at all possible. And then we want to make sure that someone is keeping pressure on the bleeding, either by a tightly wound bandage around the area, or if someone is available to keep pressure on there with their hand. Eye drainage is something that can be concerning, and so I wanted to just cover how to know when it's normal and how to know when it's abnormal. It certainly can be normal, just like in people, to get a little bit of eye drainage on the inside corner of the eye. When it is abnormal, though, it can be caused by cuts on the surface of the eye on the cornea. They can have blocked nasolacrimal ducts, so the duct that leads from their eye down to their nose, and a variety of other things, including infections, grass-ons getting into the eye, dust getting into the eye, those kinds of things. When do you know it's time to call the veterinarian? If you notice that animal is squinting, If you look out into the pasture and that animal is standing there and it's holding the eye closed, that's a really good sign that that eye is painful. If the eye is red or there's a lot of drainage, or you notice the animal rubbing the eye, either up against the barn or up against the fence, those are all signs that there's something abnormal going on. I have a picture here of an alpaca who's receiving an eye medication to numb the surface of her eye, but her eye is normal, and so I've put this picture in here so that you'll know what a normal eye looks like. You notice that the soft tissue around the eyeball itself is kind of a light pink. It's not red, it's not irritated looking. And then you'll notice that around her iris, there are the little black finger-like projections that come down into her pupil. That is normal in llamas and alpacas. Those are normal structures within the eyes that are perfectly normal. And so don't be alarmed when you see those, because those are unusual. We don't see those bodies in other animals. Is it an emergency? Typically not. If you saw an injury occur to the eye, or you know that it came on suddenly, then it does need to be seen urgently. So while some of these may not be emergencies, they do need to be seen very quickly. If you suspect that an animal has a grass on in the eye, or they are extremely painful, or again, if you saw a trauma happen to the eye, then a veterinarian needs to be contacted on an emergency basis. What do you need to do until the veterinarian arrives? Keep them in a dark, quiet place. When there is an injury or infection in the eye, animals are very, very sensitive to light. And so being out in the bright sunshine when you have an injured eye is excruciatingly painful. So we want to move them into a dark area that doesn't have a lot of dust so that they're protected from the light, and that can provide some pain relief. You'll notice in the upper right-hand picture that we have this animal here that actually has some infection in the front portion of the eye. And you can see that there's lots of redness around on the inside of the eye. That's a really good clue. When you see a lot of redness there, that animal needs to be evaluated. Similarly, in the lower right-hand picture, it's an alpaca's eye that had a laceration or an ulcer on her cornea, the surface of the eye, and you may not be able to see very well in the picture, but the surface of the eye is kind of white or blue and cloudy. But then you notice towards the left-hand portion of the picture, you see that she has a lot of drainage coming from the eye. And so it's not just that small amount of dry, crusty material in the corner of the eye. It's actually running down her face. And when you see that volume of fluid, that absolutely needs to be seen. So the last thing we'll talk about is administering medications. With oral medications, we talked about haltering safely earlier, and we also talked about how animals don't like to have their heads handled. And so we want to make sure that we are competent and efficient at giving oral medications. And so what we're going to do is we're going to walk up and approach the animal, take our fingers and insert them into the corners of the mouth. That will cause the animal to open up their mouth. And then we can insert the syringe or whatever we're using to give this liquid medication in the mouth, and we're going to squirt that in. We want to squirt it in back behind the base of the tongue, which is going to mean that our syringe needs to go into the mouth quite a ways. So make sure you keep a good hold on the syringe so they don't try to chew on it or swallow it, and then install the medication back at the very back of the mouth. The reason for that is they can be highly effective at spitting out medications. And so we want to deposit it at the very back of the mouth so that they don't have that opportunity. Intramuscular injections, some injections need to be given directly in the muscle. We prefer not to use this method in llamas and alpacas unless it's the only way a medication can be given, because they just don't have a lot of muscle mass. But if you do need to give an intramuscular injection, it's best to do it in front of the shoulder, in the side of the neck, as you can see in this animal, about halfway down. And you see that the operator here is inserting the needle straight into the muscle. We're not going to use any size needle that's longer than 1 inch because we don't want it to go in too far, obviously. Once we've inserted the needle directly into the muscle, we're going to draw the plunger back a little bit to make sure that there's no blood that is in the hub of the needle. And if no blood appears, we're going to give the injection there. We also prefer to only give very small volumes of injection, probably not more than 2 to 3 mils or cc's per site for this. If you draw back on the syringe once it's inserted and a little bit of blood shows up in the needle, you can simply withdraw the syringe and needle and go to another spot on the neck and do the same thing until you find a spot where you don't draw any blood back. For an under the skin injection, which is much our preference in llamas and alpacas, we can give it back behind the elbow, as in the left picture. So this is the fiberless area that's on the side of the chest behind the elbow. And we can just tint the skin there because we can see really well because there isn't any fiber there. And we can insert the needle underneath that tint of skin and then inject our medication or vaccine there. We can also do it in the same site that we did the IM injection or intramuscular injection, but in that situation, we're going to tint the skin on the neck like we did behind the elbow and insert the syringe and needle at a more steep angle so that it's more parallel to the body rather than perpendicular as we did with the intramuscular injection. Finally, I want to direct your attention to this pre-examination checklist. This is a very useful resource that was made available by the Mid-America Alpaca Foundation. What it has is, it has a variety of questions on it that your veterinarian is likely to ask you when you call with a sick animal. So things like, what's the current problem? How long has it been going on? Have you given any medications? Has that resulted in any changes? How far pregnant is she if it's a female? Have you noticed urine production? What does it look like? Have you noticed any runny eyes? What did that look like? Those kinds of things, so that when you go back to the house to call the veterinarian and you're not out at the barn looking at the animal, you will have all those answers to those questions in front of you when the veterinarian asks. It also provides a place up at the upper right-hand corner for your veterinarian's name and phone number, so that you're not hunting around looking for their business card or fumbling through the phone book. It's going to be right there available. And so what we recommend that you do is that you obtain one of these checklists, which are available free of charge on the website for the Mid-America Alpaca Foundation. You can simply download the PDF, get that laminated, and have it hanging in the barn with either a wet dry erase marker or a wax pencil. And that way you can use it for an animal that's sick right now and then wipe it off and have it in the barn available for the next time an animal gets sick. And we've just found this, and many farms have found this to be a very useful resource. It is available at the Mid-America Alpaca Foundation website. You go to the left-hand side and click on Downloads, and then it's called the checklist or the pre-exam checklist. And if you'll click on that, the PDF will come up and you can download that, and again, it's free of charge. Remember that the Mid-America Alpaca Foundation has given lots and lots of support to veterinary colleges to encourage the education of veterinary students in the areas of llama and alpaca medicine. And so please consider supporting the foundation and their efforts in veterinary colleges to improve veterinary care for llamas and alpacas by considering a donation in exchange for the use of this very valuable checklist.